Good afternoon, everyone. Welcome to the Kern County Emergency Medical Care Advisory Board meeting of February 13th. At this time, we'll call the roll.
Chairman Flores.
Here.
Dr. Lyon.
Here.
John Surface.
Here.
Chief Linville.
Here.
Leslie Wilmer. Dr. Franklin.
Here.
Tyler Wetzel.
Here.
Maribel Reyna. Orchel Cryer.
Here.
Donnie Youngblood.
Here.
We have a quorum.
Okay, thank you. Okay, brings us to salute to the flag. I would like to ask Tyler if you would lead us in the flag salute.
Please stand. Salute. Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you. Now we'll be doing the consent agenda. All items listed with the CA are considered by program staff to be routine and uncontroversial. The CA represents the consent agenda for the board members of MCAB. Consent items will be considered first and may be approved in one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of MCAB may remove any item from the consent agenda, and it will be considered in listed sequence with an opportunity for any member of the public to address MCAB concerning the item before action is taken. So at this time, just call for a motion on consent.
Youngblood motion.
Lyon second.
Thank you. We have a motion and second. All in favor?
Aye.
Opposed? Okay, motion carries. Thank you. That brings us to item 1, public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask questions for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making any presentation. So are there any members of the public here that would like to address MCAB under public presentations? Okay, seeing none, we'll move on to board member announcements. Okay, seeing none as well. That brings us to emergency medical services program request, and I'll refer this to Mr. Ferris.
Thank you, Mr. Chairman. EMS continues to remain busy with improvements to the system, conducting quality improvement reviews, providing training to the public, continually reviewing policies, procedures, and protocols, and many other projects. Unfortunately, recently we lost our training coordinator, Edlyn Blankenship. She left us to go to nursing school and do better for herself. We will miss her. We wish her all the best. Our certification team completed 327 certifications and accreditations in the fourth quarter of 2024. This includes EMTs, paramedics, emergency medical dispatchers, and mobile intensive care nurses. Currently, our EMT certification coordinator is working feverishly to get all firefighter EMTs recertified by the end of the month. Later this month, EMS will be hosting a mandatory update training for all paramedics working in our system. It will take 5 full days to get all 267 paramedics brought up to date on all changes made to policies, procedures, and protocols. With the new year brings the new event season. We will be seeing numerous large-scale events in 2025, starting with Boots in the Park in March at the Kaiser Sports Center with an estimated attendance of 10 to 12,000. Neotropolis in April in the East Kern with an expected attendance of 2,500. On May 17th, Kern will host the Luke Bryan Farm Tour on a farm outside of Shafter with 20,000 estimated attendees. Also in May, Bequinox in California City with 1,500 attendees expected. And finally, our favorite Lightning in a Bottle, scheduled for Memorial Day weekend at Lake Buena Vista. And this year, they have informed us they're fully expecting 30,000 people. EMS has completed our emergency medical dispatch code review for 2023 and 24, and that has resulted in 115 downgrades, 25 upgrades, 1 fire-only response, and 17 new codes added by the Academy of Emergency Medical Dispatch. We will be distributing for review to our dispatch centers, followed by the field agencies prior to implementation. In addition to all that, EMS is still working through the review of all policies to assure that they are up to date and appropriate. Our emergency preparedness team, which includes our Regional Disaster Medical Health Specialists, or RDMHS, have been extremely busy working with Region 5 counties, including here in Kern County, with the H5N1 virus and Marburg virus pre-planning. At the same time, they worked closely with the RDMHS from Los Angeles County during the Palisades fires, including the organization of 2 ambulance strike teams to that area. They are currently working with the state to prepare for the current storm and its possible effects on burn scar areas. And they're assisting in the implementation of a statewide hospital bed availability platform. EP has distributed $170,000 in grant funds to medical health facilities to assist our partners in being better prepared for disasters. The EP team is working on acquiring another large trailer-mounted generator and several large portable battery backup systems to be available to our med health partners during PSPS, public safety power outages, or other power events. EP staff attended a special pathogens exercise hosted by the state and federal governments, where they gained information on the need to update the regional highly infectious disease plan, and that the only hospital equipped to handle highly infectious diseases is located in Los Angeles. As a result of this training, we have begun the process of acquiring an isolation transport system to transport highly infectious patients safely. Our EP team has also facilitated an evacuation drill and mega code for the Advanced Endoscopy Surgery Center, one of our many partners. And they planned and conducted a multi-casualty aircraft event, which included a radiation component for 70 of the Kern County Healthcare Coalition members. We have completed the first round of the required classes for the County Emergency Operations Center Type 3 certification. This included all of the public health DOC staff and EMS and EP and leadership staff. We are hosting interviews at this time, actually next week, to hire a warehouse supervisor for our emergency preparedness warehouse. This warehouse supervisor will ensure all grant EP supplies will be maintained, rotated, and be ready to be deployed at a moment's notice. This concludes my report. It is recommended that the report be received and filed, and I'm available to answer any questions.
Okay, thank you, sir. Are there any comments or questions? Yeah, Mr. Carter.
Orchard Crier. Now, is the H1, not the H1, but the bird flu epidemic, is that going to affect a high-risk category?
Well, eventually, I'm assuming if it jumps and can be passed from human to human, yes, it will.
Have they had one already that has done that?
Not to my knowledge as of yet.
Okay, I thought, I mean, it was misunderstood, but I heard they had one death from that already.
I'm not familiar with one. Maybe one of the physicians can answer better.
I don't think the mics work. Oh, there it is.
There was one death, I believe, in British Columbia. And then there was another, I think, back east, but in Louisiana, yeah. But none of them have been linked to is my understanding, the strain that we've been dealing with in the dairies. They've been more from the wild bird population, is the assumption.
Okay. I've been, being the agriculture industry and stuff, I've been watching it pretty close, and especially, like I said, the birds having more now because they're out there free ranging. They're getting more because of that free range stuff imposed by our government. So that could be cage-free birds, that there's more epidemics coming, more birds are getting the bird flu from that, from the wild birds flying over, eating the poop and stuff, or different other debris. And that's my concern, but I just hope that the concern don't spread to the humans, and all of a sudden we're got a huge population epidemic, concerns. Thank you.
Okay, thank you. I think that's it. I heard something about Marburg. I don't want to hear anything more about that. Okay. But that is I'll need a motion for this one.
Lyon, motion to receive and file.
Okay, motion, do I have a second? I'll go ahead and second it. Okay, all in favor? Aye. Opposed? Okay, motion carries. And that will continue with you, Mr. Ferris, for the APOT Task Force report.
Thank you, Mr. Chairman. At this time, I'd like to call Bryn Kerrigan up to the podium to provide the APOT Task Force report.
Welcome, Bryn.
Good afternoon, Mr. Chairman and members of the board. As Mr. Ferris stated, my name is Bryn Kerrigan, Director of Kern County Public Health. As you may recall, during the November 2024 MCAB meeting, your board directed me to meet with the hospital CEOs regarding ambulance patient offload times to determine their desired attendees for the APOT task force meetings and to obtain their input on making the APOT task force meetings productive. On December 11th, I attended the monthly Kern County Hospital CEO meeting. During the meeting, the hospital CEOs reviewed the current APOT task force attendee list, provided an update of their preferred attendees, and provided direction on what they believed would make the APOT task force meetings more productive. Specifically, they asked for the APOT task force meetings to occur monthly, that they occur in person and not be available virtually, and asked that I be the one that facilitated the APOT task force meetings. They also requested that APOT task force data be sent to them monthly via email, and that a trend of the data over the previous couple months be included in the monthly data distribution. On January 7th, 2025, an invitation was sent to all of the attendees identified by the hospital CEOs in December for our first APOT task force meeting of 2025 to be held on January 23rd, 2025. The body of the invitation clearly outlined the expectation that the APOT task force meeting was going to be held in person at Kern County Public Health on Mount Vernon in Bakersfield. The meeting was held at 1:30 p.m., and aside from the representatives from Liberty Ambulance, Hall Ambulance, and Kern County Fire, only 2 hospital representatives were in attendance from Mercy and Kern Valley Healthcare District, which didn't make the meeting as productive as I had hoped. However, we still made the best use of our time. Specifically, we reviewed ambulance call volume and transport volume for calendar year 2024 and did a deep dive of the data for December 2024 with the hospital representatives that were present. We reviewed the California Emergency Medical Services Authority's report to the Commission on ambulance patient offload delays for calendar year 2023 and 2024. The report that stated that Kern County had the highest percentage of total offloads that were delayed greater than 30 minutes in this state for every month included in both years of the report. We went around the room and we identified each attendee's thoughts on what was the leading driving factor for APOT delays in Kern County. The answers included hospital throughput, interfacility transfers, and staffing. Following the January APOT Task Force meeting, I did send an email to the hospital CEOs with a report of attendance at the meeting and a request that they prioritize attendance at the February meeting. I did receive a response from every hospital CEO that was not represented at the January meeting with an apology and a commitment to